Hi there, aviators. This is Dr. Cole Weatherby with AME.answers. And the question today is about hypertension. So, an airman came to me and asked, my doctor just prescribed a blood pressure medication for me. What does that mean for the FAA? Are you going to have to deny my medical certification? Well, luckily, the FAA has done a solid job dealing with hypertension and how that affects medical certification and made things pretty easy, honestly. So nothing to have too much stress about it. So I'm going to try to keep this one pretty short and to the point today. Before I go into how high blood pressure is going to affect your medical certificate, let me talk about how high blood pressure can affect you. I see a lot of pilots who, whether it's because of pride or fear of the FAA, they just ignore hypertension for years until finally maybe they have some problem that comes up as a result of their high blood pressure that they can't ignore anymore. So I really want to drive home that having hypertension that's untreated and unchecked is incredibly dangerous and hazardous for your health. And it's one of the things that is fairly straightforward to treat, and there's no reason to delay that for pilots or anybody else. So just to run through real quickly what hypertension can do to your body that can interfere with your ability to fly or really do anything are things like heart attacks, strokes, heart disease, aneurysms, congestive heart failure, kidney disease, dementia, retinal damage, all things that are pretty serious, and you don't want to play with any of that stuff. So if your blood pressure is running a little bit high and it's been that way for a while, definitely reach out to your primary care doctor and get on treatment. Now, how is this treatment going to affect your medical? Well, luckily the FAA has developed something called the CACI for hypertension. CACI stands for Conditions AMEs Can Issue. And it's a set of criteria that we use to issue medicals without having to defer and get the permission of the FAA. So as long as you're able to meet the criteria of the CACI, you will get a medical certificate issued to you, and the hypertension won't really be a problem. The requirements for the hypertension CACI are pretty easy to meet. First thing to talk about is medications. You can be on 3 blood pressure medications or less. And most blood pressure medications are allowed. There's only a short list of medicines that are not allowed, and these are what are referred to as centrally acting antihypertensives, mostly ones that can cause sedation or central nervous system effects. And these are things like clonidine, guanfacine, nitrates, methyl-dopa, reserpine. Really, out of all those, the only one that you commonly run into might be clonidine. So if your doctor is mentioning wanting to start you on clonidine, you might stop him and say, let's try almost any other blood pressure medication besides that. Another requirement is that your blood pressure has to be stable on the current treatment for 7 days. So if you've had a recent change in your medication, before we can officially sign off on your medical, you have to be stable on the new medicine for 7 days. And if you have a medication change while you're out there in between medical exams, you should ground yourself for 7 days to make sure that things are stable before you fly. Also, to meet the CACI criteria, your blood pressure in the office should be 155/95 or less. That is the high-end cutoff that the FAA designates. That's not to say that a blood pressure in the 150s/90s is good. That's still too high. But we understand that sometimes AMEs tend to raise people's blood pressure a little bit. So, there's that allowance there for the pressure on the day of your exam. Also, you cannot have any side effects from your medication. So if you come in and tell your AME, I'm on this blood pressure medicine, it works great, but I feel sedated or depressed all the time, then that's a problem and we can't use the CACI. So if you meet all those criteria, there's really nothing else to do. We're able to sign off on your medical and you go about your life. If you happen to be on more than 3 blood pressure medications, that doesn't mean that you're going to be unable to get medically certified, but it's going to have to go through the FAA. And typically they're going to want you to have a full cardiovascular evaluation and see a cardiologist and have an echocardiogram and some other workup done, like a stress test. So that's really it when it comes to hypertension. Pretty straightforward. You can look up these CACI criteria online. I'm going to link them below in the comments. And feel free, if there's something I didn't address today about blood pressure, to write me a question in the comments or shoot one to my email, and I'll do my best to respond to that. Thank you so much. I appreciate you watching the channel, and please like the video, subscribe, and stay tuned for answers in the future. I also always like to mention that advice that I give here on the channel is not really a replacement for a good consultation visit with an AME. If you have any questions about how things pertain to your individual case, set up an appointment or have a phone call with your AME and get those questions addressed. Thank you so much.